the Audit Finance Committee meeting, April 24th, 2024. I'd like to welcome Councilwoman Wiley. Thank you for joining this esteemed committee, review our finances, and give us your input.
It's really the most important.
And thank you to staff for being here. Just a little quick house cleaning. Since we need to appoint a new chairperson, I am going to nominate Councilman Fears to do that so we can get the meeting fully underway.
I second.
All in favor? Aye.
Aye.
Well, congratulations. I will turn this meeting right over to you,
All right.
Chairman Fears.
Thank you. Thank you. Well, let's start with who's present. So we have, Don's already said who we have here on the committee. Let's talk about who else is here in the room. Let's test out this new microphone system and let you guys all introduce yourself. We'll start with Andrew.
Hi, I'm Andrew Frazier. I'm the new management analyst for the City of Independence.
Zach Walker, City Manager.
Jamie Reemsmeyer, Interim Assistant City Manager and HR Director.
Melissa Sill, Budget Manager.
Nancy Cooper, Special Projects and Reporting Manager.
Hi,
Your
everyone.
new face.
I know, brand new. My name is Megan Borth. I'm the Interim Finance Director, and today's my first day. Excited to be here.
Well, welcome.
I
Megan.
know, we're getting started.
Happy to have you. You're getting initiated with fire here, right? Or water or something. I don't know. Maybe power. Since we're in the power building. All right, good deal. And we have other attendees around the room. So welcome everybody, and we will proceed accordingly. So with that, we need to approve the minutes for the January 31 meeting. We have a motion to do that.
I have a motion to approve the minutes.
Okay. We'll let you second it, Heather, just so that I'm not.
I'll second.
And I know that's hard to do since you weren't here,
I
right?
know.
So, all right, all in favor, say aye.
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 All right, anybody opposed? All right, good. All right, well, we've got a report by Andrew Frazier on the Arch Review and maybe some other things that he's going to talk with us about, and then we can talk about what we can do to keep him busy for the next period of time.
All right, forgive me. I gotta get this situated here.
Yeah, they put you in the wrong, with the wrong screen up.
All right, everything looks good. As previously mentioned, I'm Andrew, the new management analyst for the City of Independence. It's a pleasure to be here. Before I get started, I'd like to shout out to all the administrative professionals. This is their day. So if you have those people in your life, give them some love. Today's their day. Kim? All right. So I'm doing a review on the alternative response to community health. This is the ARCH program. Been talked about quite a bit. So the objective of my performance audit was to enable those in governance to basically assess the program in effectiveness, economy, and efficiency. This is a nice fancy photo of the team. Members are also here present today. A little bit of background on the program. It was launched in October of 2021, entering its pilot phase in 22, and then fully operational by July of 2023. So it's been almost a year since you guys been fully operational. Let me go back real quick. This mouse isn't really working for me. They function Monday through Friday. The initiative aims to offer a compassionate, individual-focused crisis response to community members grappling with, mental health issues, depression, homelessness, a whole litany of things. The ARCH team comprises members of both the fire department and the Health and Animal Services Department. We got 1.5 members of the fire department, basically, one full-time, one part-time, and then 2 licensed clinical social workers. The objective of this review is to basically determine how is the program achieving its goals, review how the program is utilizing resources effectively, and review how the program is operating in a cost-effective manner. The utilizing resources effectively is kind of what I'm going to hit on mostly. Some of the other stuff's pretty straightforward. And I was doing this review with guidance from the government auditing standards. I don't know if any of you are familiar with that, but it's basically like the Bible of government auditing. So I had that in mind when completing this review. So with that methodology, obviously I had to get out there, interviewing key stakeholders, members of the team, and I'm eternally grateful for their participation in this. Everybody from the fire department, from health and animal services, and even IPD. Obviously, collect and evaluate, verify that there's one of the big key things was service overlap, but in this process was to collect, evaluate, and verify if there is any service overlap with different departments, and then collect and assess program costs. So the goals, I was able to determine the goals by talking to the stakeholders, again, the department heads, the team leaders, even on the city website, it's outlined, what the goals are for the ARCH program. So the goals are to promote community health and well-being by helping local resources be utilized by those most in need of their service. Another goal is to help keep emergency responders like IPD, IFD, or EMS, which I guess is AMR, available within the community by assuming low responsibility for low acuity emergency incidents. Another goal is to decrease overcrowding in local emergency rooms. Another goal is to ease the stress and burden from those community members needing emergency medical care and evaluations. And of course, these goals are achieved by the team. They achieve these goals by connecting the community members with the most appropriate resources available, meet people where they are in the midst of their challenges, and providing support that can lead to some sort of long-lasting positive outcome. They also do this by providing free voluntary transport on a case-by-case basis to avoid unnecessary ambulance costs. They also provide clinical mental health assessments to guide on-scene crisis mitigation and definitive care transport options. Give in-the-moment support through providing crisis intervention and actively extending empathy during some of our community members' most challenging life experiences. They provide extended care and support through follow-up visits and with individuals who use their services. So ultimately, the objective is to ensure the community members who do not require urgent medical attention are directed to suitable resources right there at the scene, thereby averting unnecessary hospital transfers. By delivering more precise care directly within the community, we are not only alleviating the workload of other emergency responders, but also ensure that they remain in service. And these goals underscore the fire department's commitment to delivering high-quality service efficiently, and the Health and Animal Services Department dedication to safeguarding health and welfare. Moreover, they align with the broader intention set forth in several of the city's purpose statements, reflecting a cohesive effort across departments to serve the community. And as you can see here, this data is, about a month old, but you can see the amount of calls for service the ARCH team has as of March 11th. They still have continued service and follow-up. There's 243 at that time. I think most important is they responded to 593 calls for service that allowed other units to be put back in service or were disregarded early, which is, I think, fantastic. So in this review, one of the main key focuses was determining if there was overlap. So one of the things that I had talked with the ARCH program about, and also IPD and CIT, was like, for example, CIT might respond to a John Doe on scene and do their CIT process. And maybe the next day or week or whatever, maybe ARCH gets dispatched and respond to the same person. And maybe they don't know if that person has already received services from CIT or vice versa. So that's where the overlap kind of comes into play. There's no reporting mechanism that highlights that part of both missions. And if there was something in place, they could see that, hey, John Doe actually is already in service in extended care through CIT, and maybe the ARCH program didn't need to respond, or they would respond differently in that case. Both serve to help those in need and have extended care and continued care components. So that's kind of where that maybe that overlap kind of occurs. So with that, obviously, I think the lack of communication or coordination is highlighted. Trying to get rid of that duplication of efforts. Some other things that popped up that were concerns. Paramedics. They have a HIPAA component with their jobs that might limit their ability to communicate. And then, the Missouri now implemented that 988 program, and it's kind of uncertain how that plays into this. I haven't talked to anybody with that program. I don't know that any of the paramedics or social workers have communicated with the state in that regard, but that's just another component to this overarching problem. The costs were pretty easy to find. I want to obviously thank every department, but finance helped me get this data. Here's the total annual cost. The biggest caveat with the cost, though, come with a Health and Animal Services grant that funds the licensed clinical social workers. Initially, that grant lasts 20 months and 29 days, totaling $373,000, and that ends June 30th of this year. Now, as of last week, talking to Christina, she confirmed that an extension was granted for the grant. Therefore, the grant now ends in September this year. So that's good news, but it's still an issue. I mean, obviously, when we get to that point in time, how is funding going to continue after that? I do have recommendations after the summary, but the summary, there's no doubt that ARCH is achieving many of their primary goals and objectives. There is service overlap that occurs with CIT, which in my mind is not inherently negative if implemented well. But obviously there's substantial room for improvement, collaboration between the two programs. And then, yeah, the losing of the grant after September is kind of a big deal. So that funds the, again, licensed clinical social workers. My recommendations were pretty simple. Obviously, integration of service, a unified management would probably curb some of that overlap, and in turn do some resource consolidation, differentiating the services in that unified management, and potential cost sharing. And if that's not deemed practical, just enhance collaboration between the two programs. Pretty simple. And regardless, I think a continued program evaluation is necessary, and along with community feedback. I think it'd be great to get feedback from the members whom we serve and get their perspective of the program. That's basically it. Despite facing the challenges and uncertainties with the program, they're unwavering. Their Arch's unwavering commitment serves as a testament to their dedication, reflecting positively on the program, the departments, and the city as a whole. And I fully support the program, and if they could expand, that would be even better, I think. But yeah, that's basically it. I'd be open to your questions for sure.
Anyone have any questions?
Sure, I'll start. Thank you, Chairman. Well, let's define some terms. ARCH, Alternative Response to Community Health, CIT, Crisis Intervention Trained. Can you explain a little bit about that, just topically, just so that the people at home, basically, that are watching can understand what that is and how that interfaces with our ARCH program?
Yeah, as a former CIT officer, I think I could speak to that.
Actually, please speak to that, because that gives you a really good perspective of having this lived experience.
Yeah, for sure. So, IPD has the CIT program. I'm not sure how old it is, but it was relatively new when I started policing, and it's similar in regards to how you approach somebody in crisis. And that doesn't necessarily warrant a police response, but oftentimes police are responding to those types of calls. And so they have trained members of their team to address those calls for service. And, there may not necessarily be a crime that has been committed, or maybe there has been. But oftentimes, from my experience, no, there hasn't been a crime committed, and I'm just helping somebody get the care that they needed. And IPD does that. And they're limited on kind of where they send people. I think they have an agreement with one of the local community health facilities. And if a police officer responds to somebody in crisis, it could potentially make the situation worse. So if somebody doesn't see an officer coming up to them, they might have a better interaction with ARCH team members, So I think this is a mental health, and all of that is a multi-pronged approach. There needs to be a multi-pronged approach so we don't have officers amping up a situation. And of course, there's times when they're absolutely warranted. But with ARCH, I could see somebody in crisis not necessarily liking the police or whatever their situation is, and they could have that heart-to-heart and be able to get these people where they need to go.
Perfect, thank you. So I had the pleasure to do a ride-along last summer, end of last summer, I believe, with the ARCH team, and it was quite the eye-opener to take that look at that little snapshot of what they do on a daily basis. So going through your report, very well done, by the way, as all things are with a new new program that we're doing, it's always good to take a look and see where we can do better, especially with something that is this complicated and have different agencies that are interfacing with one another. But a couple of things that did kind of stick out with me was some of the cost savings, possible cost savings that we are doing by implementing this. Just looking at page 7 here on canceled calls, the total number of calls for service that Arch responded to, about 593. Is that calls that just were not, calls that did not have to be responded to by either fire or police?
That's correct. Or they were called off early. So
Okay.
maybe they were responding and Arch was like, you know what, we got this, guys. You can go back in service.
Did you have a specific breakdown of what calls were called off by police and what were just not initiated by the fire department?
So I did get to observe the Arch team's Excel spreadsheet that has everything on it. And I imagine that that type of data is there. But I could probably get that to you relatively quick.
I would be curious to see, just doing just quick fun math, if this was just straight fire calls, if
Sure,
the fire department did
sure.
not have to pull out 593 times, that's a savings of $581,000 at $980 just to pull out of the fire station. So
Yep.
if you want to do more fun math, cut that in half, that's $290,000 of cost savings just pulling out of that, and that doesn't include wear and tear and others. So just by just raw face value, that's cost effective there with that. The other seems to be the communication point is maybe better well, my assessment is a better communication between the two groups, the police and CIT. I know they're beginning to work on that and having conversations and different with our other health providers within the city. Is there anything specific that you can help maybe jumpstart that conversation with or bring some thoughts to that table?
I think if there was a central repository program where they could access data from their previous calls, I think that would help tremendously. Because something that the IPD officers and the Arch program team can both access, so they're not going to the same person and starting over again, maybe just continuing their service. And I don't know that that program exists, but something like that, I think would be tremendous and help, but other than that, just simple communication back and forth, which it sounds easy when I say it, but I'm sure there's hoops there to overcome. These folks are only Monday through Friday, and CIT's, it's a IPD 24/7 type thing. So, yeah, just having that simple conversation maybe between leaders or something like that.
I believe one of your recommendations, conclusions, was to certainly keep the city to sustain and increase funding for the Arch program with anticipation of its future expansion, which I agree with. I think this is well worthy of the cause to keep refining, to keep digesting the information, and bringing in more of our community partners to just do a better service for our community to get those folks the help they need, but also gives, I think, also equally as important is to be able to give our citizens of our community the good understanding that we are working and striving to bring relief to areas that need that. Then I'll turn it back over.
Another question I had, Mr. Frazier, is relative to the dispatching piece of the puzzle. You talked to that just a little bit, and I wondered if there's anything more you could add to, the dispatch question.
Yeah, I know the Arch program team had communicated to dispatch about how, because basically dispatch has like a tree. If a call comes in, they go through the tree, and that's how they dispatch. And they talked about adding a arch portion to their little tree their little matrix that they have. And, you know, since there is overlap, maybe they don't go straight to arch, maybe they go straight to CIT. So maybe kind of defining those better for the dispatchers would be beneficial for sure.
All right, that's helpful. I think Councilmember Perkins hit on my other points. Mr. Walker, any comments you want to make or your staff would want to make regarding this?
Thank you for that opportunity, Mr. Chair. I would begin just by thanking Mr. Frazier for his report. I think it was very well done, clear that he spent a lot of time in the field and then also with the various stakeholders on this. So it's very helpful to have that analysis, particularly when we've got a new program like this without as extensive as a track record. As my official response to the audit said, I think the recommendation about integration of services is critical. You know, the community doesn't always recognize, you know, who's with what department or providing what service. They need a service provided to them at that moment in time. And so looking for ways to add that layer of efficiency in, but also to help make sure we are able to fund this at an adequate level, I think where we can resource share makes a lot of sense. It will take time to get there because of some of these, you know, current prohibitions that exist. But the only other comment I think I would add, and maybe this is more germane to the agenda item on future work plans, I think some sort of audit that builds off of this and takes a more global look at dispatching in the community is important, because that is obviously the epicenter of where these calls come in, and how that is handled and how those are routed. That's what makes all the difference in that efficiency and cost effectiveness. And I suspect there's some opportunity to better strengthen that service and maybe get rid of some of that partisanship that exists right now and have a more seamless process. But all in all, this is an excellent report, and I think builds on the opportunity to further review this program and figure out how to make it even more efficient in our community.
Okay, thank you. Before we go to the discussion of, you know, other activities for management analysts to work on, I guess, Mr. Frazier, anything else that you wanted to share with us regarding anything else that you've been working on or anything?
So when I initially got here, I totally missed the first Audit and Finance meeting, so I wasn't able to get my guidance then. I hadn't started yet. But you know, talking with council members, it became apparent that maybe the fleet operations and management was one of the topics to be reviewed. And I think Eric Green had, well, I know Eric Green had a report ready for you all, but it was never presented. And that report now is almost 2 years old that he had made. And I don't know that that information is still valid anymore. I think his recommendation was an overarching fleet management department with a department head. And obviously we're not to that point, but I do know, speaking with some of the other departments, specifically Park Recs and Tourism, that they have consolidated some of their fleet management operations, and some of the stuff reflected in Eric's, the former management analyst's report. It's just, it's not even it's a moot point at this time.
Gotcha.
So.
Okay, well, I knew that was out there, that had previously been worked on, but you're right, there was a long lapse in time between when he left and when you arrived, and there was ample opportunity for change to be happen. I think, without any objection, I think maybe if you could pass that off to the city manager, I'm sure maybe you've already seen that, but
I actually have not yet seen that final product.
Thought being is to pass that off to the city manager, and that way he at least has that information. Maybe just forward a copy to us so that we can look at it, even if there is pieces that are not applicable any longer. At least
Sure,
we can-
will do.
we can have
Absolutely.
that, so that'd be great. So with that, let's talk about other things for management analysts to work on. I have a list, but anybody else have a list before I kind of? All right, well, I have 3 or 4 items that I thought, and I think we need to prioritize these for Mr. Frazier's benefit, but I'm just gonna read down through them. One of the items is rental ready. We had a citizen come and talk to us at a council meeting sometime back about the rental ready program and how that is just the process that works through. That's one. One is just the business process results. If someone, both in permitting to build a new facility or to open a new business, just how that process works, and how, what kind of perception the community has and the businesses have relative to how well we've done. I know that the Chamber of Commerce, they just, I was at a meeting this morning, they just announced that they're gonna do a survey of businesses that have maybe been through that process in the last year and take a look at that and see how what their experience has been for those businesses. But I think it's valuable for us to take a look at that process and just make sure there aren't gaps that we can do to be more customer focused, customer friendly in that process. That would be one that I have. It'd be interesting to, well, someone else gave me this idea, and that being that it'd be interesting to take a look at at our portions of our budget and how the functions in our budget compared to other communities, and how well, if we're way out of percentage wise in terms of how much we focus funding towards certain functions as opposed to other communities. That might be an interesting take a look. And then the last one is one we already mentioned, and probably would be my highest item on the list, would be public safety dispatch. I think that there are there's some opportunity there to get some efficiencies based on what I've heard. So I don't know if anybody else has anything else. Those are just the ones that I've kind of heard and come up with on my own. Anybody have other thoughts, and what would you see as being higher priorities?
I like the dispatch would be a good higher priority. The business licensing process, I guess my question would be, are you wanting to be more focused on entrepreneurial startups compared to a North Point, or depending on gross receipts that a business would have? I would be more focused on how do we work with smaller businesses, and how do we streamline that and make those processes better?
Yeah, that's kind of was my thought relative to more. I was thinking more of the smaller business because we have a lot more of those. But to when a company says, okay, I want to do business in independence, I think there are multiple points of entry there, and depending on how they come into that process may depend on how their experience would be, and maybe there's some room for improving their experience within the city, so that I think I for one have heard for years that independence is difficult to work with. Now I don't know that that's accurate any longer. I think it was a time where it was, but I'm not sure it still is. But maybe there are things we could do to improve it even more, and so that was an area. But I think from a priority standpoint, you know, I would be certainly more comfortable with a first priority being the public safety dispatch piece of the puzzle. If you all are in agreement with that, I'm just looking, and then maybe moving to the business side of things. And the rental ready kind of could really flow right in with that. It's the same general process, and the rental ready process is the same as kind of the business process, and in many ways. So it's kind of done in the same general area. Does that give you enough marching orders? I mean, obviously, you can come back and ask any of us our questions or thoughts, but.
No, yeah, that's great. I think at the last council meeting, we talked about maybe a comparative analysis of services with other cities, and I didn't know where that kind of sat on that priority list. 'Cause I kind of already started that. 'Cause
Oh,
I
you
was
did?
kinda, but not a big
Well,
deal.
depending on how far you are into that,
I
I mean,
just
you know, if
started.
you got some information, or I think, but, you know, I don't want to interrupt.
No,
right in the
I'm
middle of it.
very early stages, but yeah, I can totally pivot and get this public safety thing going. So.
I think that would be our
Perfect.
preference, yeah, so.
Perfect.
Sounds like that's where we would steer you.
Perfect.
Okay. All right, great. All right, well, thank you, for your first report is in the books, in the
Yeah.
can, so to speak.
Thank you for the opportunity.
All right.
I guess
Good
Melissa's
deal.
up next. I teed it up for you.
There we go. Bring Melissa up and talk about priority-based budgeting. This is exciting. Exciting to some of us, anyway.
Okay, so for those that don't know me, I'm Melissa Sill, the budget manager. I will actually be using a lot of the same language that Andrew just used when he was talking about the ARCH program. So I'm just going to jump right into it, perhaps. There we go. Okay, thank you. All right. So the challenges facing today's leaders require something different from our budget process. This is not something that is unique to the City of Independence. And I will tell you that just from emails I receive from different organizations that provide budgeting software, out to cities, that priority-based budgeting is something that is driving a lot of the innovation in that type of software. Just because line item budgets don't provide enough detail anymore for, both leadership, management, and the organization as far as what are we actually accomplishing with our budget dollars. This gives you a brief breakdown of what we do to arrive to our program costing and our priority costing in priority-based budgeting. So we start with the line item data that was uploaded by the budget team. Departments then provided us with a program inventory. From those two items, the line item data and the program inventory, then departments are able to come up with what is called program costing. So they're able to tell us the cost based on personnel and non-personnel line items for every program that the city provides to the public or internally. And so once we have that, then we move on to program scoring, which is 2 levels. The first level is the department will go through and they will rate their programs against the city strategic plan that's developed by city council and mayor. And then after that, we have a review process that's called peer review, in which an independent team goes through, reviews, just make sure that, departments didn't go through and mark that everything that they do is the highest priority against the strategic plan. Or in some instances, they might say, well, I think this program probably has a higher impact on this particular, item from the strategic plan. And so it's just a validation process to make sure that things are done properly and fairly. And then at the end, we go through, we validate all of that, we make sure We look if anything has moved what we call quartiles. So we have quartiles 1 through 4, 1 being our highest priority programs, and 4 is our least. So we'll look at programs that may have changed as a result of the peer review process, make sure that if they have, we go back to the departments, we can discuss those, and make changes until we arrive at the final scoring. And then the last step, once we've done all that, we can finally take action. So what's the purpose of this all? Makes more compelling budget proposals. It ensures that the programs and services that we're providing are in alignment with our priorities. It provides for optimization of our resources. And then it becomes data-backed. It's not just someone's whim saying this is really important for us. We're actually able to tie it back to the strategic plan and say this is why it's important, because it's meeting these particular criteria. So, influence budget decision making. So, budget decisions are driven by priorities. In the basic budgeting logic, programs are linked to priorities. Decision packages are linked to programs. So, decision packages at this point could be, additional requests for budget. It could be, it could be several different things there. And then making sure that decision packages are tied back to priorities. So those decision packages, making sure that they meet both programs and priorities. Opportunities for readily available resources. So this is the basic budget blueprint that every single city will start off with at the beginning. And so when departments are going through, they will have to identify, we have no new needs, our budget's going to be status quo, or the more likely thing here is we have new needs, we need to launch new programs, like the ARCH program, or we have a need to enhance current programs. Obviously, these things are going to be either community-driven, or unfortunately for us, sometimes they might be a state or federal mandate that's handed down, and our budget will increase as a result of that. So, in order to fund those new needs, we have two options. We can free up resources and reallocate existing resources, or we can generate new revenue. So to free up and reallocate resources, we can look at sourcing, we can look at efficiencies, and we can look at service levels. Generating new revenue comes from fees and charges, grant funding, and as the last resort, looking at taxes and rates. So I would encourage you, if you have time one evening where you're just looking to kill some time, having trouble falling asleep, look up the city of Pittsburgh, Pennsylvania. They had an initiative where they wanted to fund climate action in their city. They utilized priority-based budgeting, and they were able to free up $41 million from their existing budget. Of course, their budget's very large, but they were able to free up $41 million to reallocate towards those funding climate action items in their city.
Mr. Chairman? Yes. Sorry. Well, can you go back one slide?
Mhm.
You got me thinking about the grant funding and how we utilize that, which are good resources to have, particularly when we do a bunch of stuff. So how do we figure that in, knowing that some of them have an end date, kind of like the ARCH program, using them as an example? How do we figure that in to be a sustainable funding source?
Well, sometimes that can be really tricky,
Sure.
right? So sometimes it can just end up being that we know that at the end of this, at the end of this grant, that general fund or potentially one of the sales tax fund is going to have these additional, let's say we funded positions. We'll have to find funding for those positions, or we'll no longer be able to fund them going forward. So, ideally, we will always have some sort of grant to help offset it, even if it's maybe a new grant that funds an existing program. And I know our departments are very diligent when they look for items like that. But it can be very complicated at budgeting time when we're trying to fund positions and knowing that, well, it may be only, funded a partial point of a year and then finding the funding to finish it out for those positions.
So we just got to be very selective on those grants that we do, knowing that at some point we'll have to incur the full cost of.
Absolutely. Yep. I mean, and it's, that's not just an Independence issue. I've worked in other cities before, and it's, you might get funding for firefighters where you have, the additional positions funded for, 2 to 3 years, and then after that, that you have to plan ahead because you're either going to have to eliminate those positions or find the current resources that you have to continue funding for it. And I just want to point out, so I have a handout for you. We use ResourceX right now for our priority-based budgeting tool. They have recently integrated with Tyler Technologies. So going forward, our hope is that they continue to integrate, and it's going to make that priority-based budgeting process more efficient for all of our departments, since we use Tyler Munis for our budgeting processes right now. But they're moving forward with integrating it together. I don't know how long that will take, unfortunately. Hopefully, we'll see something in the next year or two. I know they mentioned that they would have some beta programs out by May, June this year. But like I said, all the major budgeting platforms are moving more towards this program-based, priority-based budgeting. And in our report, so if you flip to page 5, from what our representative at ResourceX has provided for us, they have identified $15.6 million in existing funds that could be reallocated out. I will warn you, they put on here 10.82% of the fiscal year 24 general fund budget. That may be that percentage of it, but I have not gone back through to verify that all of those savings are part of the general fund. So as of right now, when we look at that $15.6 million number, I want you to consider that across all of the city's funds and departments. Okay. So what priority-based budgeting does, we look at a set of questions essentially as we're going through and ranking and rating our programs. And some of the questions are, is this something that we are mandated to do? If we're mandated to do it, to what degree are we mandated to do it? Is demand for a program increasing or decreasing? Obviously, if it's decreasing, then we should be allocating less of our budget to go towards that program. Is this something that's offered by another organization? And is it even aligned with our priorities? And then lastly, we also look at cost recovery. So is this something that even if we decide we want to continue on with the program, maybe it's something that the public would be willing to pay a fee or a charge to have continued access to? So discovering opportunities to reinvest. So on this particular slide, we've done a screenshot of programs that are least aligned with council priorities and that we are not mandated to provide. So from these top 10 programs in this category, it's about $2.25 million that we have invested in it annually. So these would be programs that we would look at and not necessarily just say we're automatically going to eliminate these. Maybe we say, and I suspect we say, fire scene rehabilitation is something that's very important to the community and that we'd want to continue on with it. But we start to ask questions, are there better ways that we could be doing this program that would result in a cost savings to the city? So, in this reallocation discussion, we look at the sourcing, efficiency, and service levels. So that would be something that we would consider when we look at, fire scene rehabilitation. Can the city map current business processes and apply technology to automate or free up our human resources, which would then allow us to reallocate those personnel? Is this something that might be able to be funded or augmented by volunteers? Can we reduce our service levels? Or is this something that we even want to continue doing ongoing? How current are the city technologies? And then lastly, can the city leverage with partners or source other entities to provide the service for us at a cheaper cost? Now, on the partnership lens, I will tell you this is my absolute favorite because it doesn't need to just be looked at on the basis of our lowest priority programs. I think a partnership lens can be applied to just about everything that the city provides. Because when we look, especially for a city like Independence that's located around multiple other cities, we're not an island upon ourselves. Is there opportunity to remove any duplication of services in which we can partner with other organizations, private, public, nonprofit? And so I think this is probably one of the best ways for us to look at reallocation of our resources. On this particular slide, you'll see that it's lowest alignment with council priorities. Other entities can and do provide the program, and there's no mandate to provide the service. I just know in my years from priority-based budgeting, one of the stories that I've heard that stuck out in my mind is a city that provided trash services. It was becoming too costly for the city to continue to provide just because of the personnel cost, replacing the trash trucks, maintenance, that type of thing. And so city council told that particular department, if you want to continue providing this, you have 1 year to come back with a plan to lower the cost, make it more efficient, so that we can reallocate some of those resources. That was enough to spur that department to become more innovative, to start reaching out and talking to other entities that are able to provide the service at a lower cost. And within a year, they were able to keep that program in their department. So questions to consider on this one. Can the city leverage partners or source services with public-private providers to free up resources? And how does staffing trend compare to the demand or output of the service? We also have program relevance lens. So this is our lowest alignment with council priorities. This might be something that we consider very low-hanging fruit. It's not meeting our strategic plan. And so we might consider this, are there programs here that we could eliminate? Are there programs that maybe need a major overhaul to make them more efficient? There's a lot of different ways that we can analyze and look at these services. And I'll tell you, and to some extent, we may have all the funding that we need for these, and we may say, well, they're not meeting our priorities, but the community still enjoys these programs, and it's something that we want to continue on with. So, do the city's fees cover cost of providing these programs? What steps has the city taken to control cost? Is cost efficiency measured? Can the city insource or provide any services regionally for a fee? And are there grant opportunities? So again, not immediately cutting out that program, but just looking at it from a different perspective. So some of these things here on this is basic program attributes. So in addition to when we look at our community priorities from the strategic plan, we look at the degree of mandate. We look at reliance on the city to provide the program. We look at the portion of the community served. We look at cost recovery, and then we look at whether demand is increasing, flat, or decreasing for the programs. So the value proposition of what priority-based budgeting offers to the city and the community. Reframe your budget around your priorities. Know what your actual outputs and outcomes are, based on the budget. impact budget decision-making. So if we need to find more dollars for a program, instead of just slashing services from, from one area to cover another, really dig in, look at how we can reallocate first. And then the resource reallocation. What programs need more funding? Where can we pull that funding from? And if we need to, where can we generate new resources from? That's the end.
All right, well, thank you. Any immediate questions anybody has? Maybe I'll ask a question. So, since you're using this on the budget process coming up, to what degree, or maybe this question for Mr. Walker too, but how are we going to bring the entire council up to speed on this process for the budget process? What's the plan?
Sure. So what we have right now in the budget process is for fiscal year 24. So departments have gone through, they have created their different programs. And essentially, we have taken the approach when we're looking at the budget at just reducing the overall costs, and the way to do that in a way that does not impact service levels. Because this information is kind of coming up at the end of our budgeting process. So the thing with priority-based budgeting is it's not something that we look at just for that period from January through May until it gets to council. So we have established, we know what we have done in the past year as far as what priority-based budgeting does, the programs and services that we provide to establish that base level. And then we'll be able to go in and identify the different efficiencies in the next budget year and how we have reallocated those resources moving forward. But the real work will come from the departments basically through the entire year. Essentially they're going to have to look at it and determine how they're best going to reallocate their resources. It can be something pretty tricky for them to do. And it's not something that, we can immediately necessarily implement as part of the budget process, just because they've got to come up with plans, identify the different priorities. One of the best things that we've also used is looking at the recovery of their fees. So are they paying for their programs, the fees that they're charging, and what are the recovery rates? Zach, I'm trying to think, what else have we?
I'm like deep in the middle of this nightmare, so I'm trying to remember everything we're looking at. Fee recovery,
Mm-hmm.
Cost allocations, the redistribution of different duties or reorganizations of services to capture some of the efficiencies you spoke to. Labor, right.
Yeah.
So those are a couple of the things that immediately come to mind.
So what we'll be able to do is once we have that fiscal year 25 set, we'll be able to show you what implementing these new changes into the budget, the impact that it's had. So it's really difficult year one until you have that next budget passed to bring it out to you and say, like, this is what we've done, until we can actually have the dollars to the different programs.
Okay, all right, thank you. Well, I'm looking forward to reading more about this. And this is obviously an introduction for us. And so, it'll be interesting to see it unfold, personally. So, I'm looking forward to that. Anybody have anything else for Melissa on that topic? Go ahead, John.
Thank you. So with the priority-based budgeting, we just have the citizen survey, digesting that, been reading that. I'm going through the citizen comments a second time. That's always seems to be the funnest route to read. they give us a pretty good framework on what they expect, and it's not out of the realm of anything that I think we all would expect in our city. So plugging that in with us as the council people, so with our, Mr. City Manager, with our council retreat coming up, is that part of working this information through and coming up with our goals and priorities coming ahead?
Yes. The objective that I see and that I hope comes to fruition on the day of your retreat is you update the action plan that we have, but that really becomes a living, breathing document that we can make adjustments to year, but broadly defines the priorities of this council and the community that you're representing, and that you're able to weave in these strategic imperatives so that as staff we can go back and work these issues to bring those visions and those objectives to life for you.
Great. Looking forward to that. I think that's going to be a good use of our time to really get in and massage a lot of this information. With regards to the fees and permits and recouping costs, fully understand where that coming, and we definitely need to stay in line. But I just want to be cautious that we don't overdo it and exclude folks as our city is really beginning to expand and grow, and certainly some of our areas, the Square, Inglewood, and Fairmont, as it develops, as they begin to have their organizations begin to do their festivals and different activities, that we don't restrict anything there that would be too cost prohibitive. And maybe thinking in the future how we can probably collaborate and work with different packaging of those multiple events and different things like that. And my other question, so on page 5, when we're talking about the 15.6 possible savings all in, I think it's pretty important to note that would be with all departments, enterprise funds, and all that. So whatever savings, those enterprise funds, general funds, that would stay within those departments, correct?
Yes, it would have to stay within their funds. And I think if you notice when you look at that, it all talks about lowest priorities, right? So these are things that are the farthest away from our strategic plan. And so it's, 15.6 million, like you said, across all funds, which it would have to stay. It's not just $15.6 million for the general fund, unfortunately. But yes, that's how we look at it.
Thank you.
You're welcome.
Okay. Anything else? Last call. All right. Well, thank you, Melissa. We appreciate that very much, and look forward to further rolling of all this out and our greater understanding of it as well. So, all right. With that, I think the next agenda item is monthly financial presentations for the end of March. I'm not sure who's doing that. You are? Okay.
Good afternoon, council members. I am Nancy Cooper. I am the Special Projects and Reporting Manager in the Finance Department. And today we're going to do kind of a high-level overview of our March financial statements. And I think you should have in your packets the printed documents there. We're just going to kind of touch on a couple of the funds. March is our 9th month of our fiscal year, so we're at 75% of the year. So we're going to kind of use that as a benchmark to look at where our revenues and our expenditures are compared to budget. We really ideally want our revenues to be at least 75% or above at this point of the year, and our expenditures go the other way. We want it to be lower, 75% or lower at this point of the year.
Sir, can you say that again?
I'm sorry. Okay. Yes. Yes. Ideally, we want revenues when we're comparing where we're at on our year-to-date revenues, and we're comparing that to where we're at on the budget. We want revenues to be at least 75% or higher at this point of the year, since we're 75% through the fiscal year. Expenditures kind of go the other way. We don't want to see them being higher than what the 75% budget. We want those to be at 75% or lower. Thank you. This point, yes. So the first page I was going to go through was the general fund, which is on page 1 of the document. The first section at the top really goes into all of our different revenue streams and where we're at with that. It's going to show what the budget was and the actuals. And total revenues and transfers in right now are at about 81%. So that's above the 75%, so that's a good thing. The middle section is for our expenditures. We list those out by each department, so you can kind of get a feel for, where different departments are trending. And right now, total expenditures and transfers out are at about 77%. So it's a little above the 75%, but, we're still right there at that point, so still in a good spot there.
Ask a question as you're going through that. So, noted that city clerk was under budget substantially, and finance was over budget substantially. Any comments on either one?
Yes, I think on the city clerk, and you might be able to help me on this a little bit, there was, at the beginning of the year, city clerk was consolidated with the council and the mayor's office. And then they were pulled back out into their own line item again. And so I think that's where some of those expenses probably are causing that lower number. The finance line, it's 104% right now. And most of that is due to the Motorola maintenance contract for the city's radio system.
Okay.
And so I think it came in maybe about $45,000 more than what we had budgeted for. So Melissa and I will be looking at that to see if, if we're going to have savings in another area that can cover that, or if we would need to do additional budget appropriations when we get closer to year end.
Okay, thank you.
The bottom section of the report is going to show the unassigned fund balance and then the total fund balance. And we really like to look at that unassigned fund balance, and we're almost at $13.5 million, which is considerably better than what we've done in previous years, but we're still kind of trying to keep a close eye on that as we move closer to year end. The next pages behind page 1, so page 2 through 6, are going to be for our 5 sales tax funds. So we have streets, parks, stormwater, police, and fire. Those all seem to be trending rather well with a 75% benchmark that we're using. So nothing of any significance really to report there. And then pages 7 and 8 are for the use tax. And the use tax is really for animal services, has their fund and police. And I want to kind of go into a little more detail on that. The use tax is kind of what we sometimes refer to that has a waterfall provision. And what that means is that at the beginning of the year, the use tax revenue is split 50% to animal services and the police use tax funds. We have a cap then for this year of $855,000 for the animal services fund. Once they've reached that revenue cap, then 100% of the use tax flows over to the police use tax fund until they reach their revenues of $4,483,000. And we met that in January. So we've had now January through March, where now the revenues, what we call waterfall, or they flow over to the general fund and the 5 sales tax funds. And use tax is doing really, really well. On pages 1 through 6, you'll see a separate line for use tax. And we have exceeded our budget projections already at March for that piece and that revenue stream.
On both police and fire sales tax, the other revenue was, the percentage-wise is really high, and, which is a good thing. But I just was curious as to what that was. If you could.
And we're looking at the sales tax, not the use tax.
I'm looking at
Please.
police public safety tax, and then next page is fire.
It's really
I'm on page 7, at least of the PDF copy.
on the police sales tax and that other revenue category, I don't have that off the top of my head, but we can certainly look at the details that went into that and get back to you.
I was just curious. I mean,
Yep.
it's not
Yeah.
a great big number in terms of the
Right.
overall picture, but it was just interesting that it was substantially higher than what we budgeted, so I was just curious as to
Okay.
what those were.
Yeah, we'll look at both of those for police.
That'd be great.
and fire and
Thank
get
you.
back to you. Report that back. The other funds that, we always like to look at are the utility funds. Those are going to be on pages 18 through 23. All three of the utilities seem to be trending really well with that 75% benchmark. Nothing of any significance really to report there. Just kind of doing a high level today. I've touched on a few of the funds, but of course wanted to open it up to any questions that you would have on any of the pages in the financials or any of the funds.
I'm looking at my notes here. Anybody have anything while I look at my notes? Fingers work. Anything, John? Well, I was just interested in, a couple of the funds have, some significant negative fund balances. And like I'm looking at, Event Center Debt Service, and then there was another one, let me look at it, that caught my eye. Workers' comp, which that one doesn't surprise me as much. But any specific comments on either of those?
I'll just speak at a high level. And
Yeah, sure.
This is a real-time look at the status of those funds. So unfortunately, it doesn't estimate revenue that's yet to still come into some of those. So for example, with the event center, it's not showing the sales tax that will still be collected for the remainder of the fiscal year, but it's real-time showing the expenses that have been outlaid. So in that case, that's probably why you're seeing a deficit or a shortfall there. In other places, even though this is a real-time snapshot, there were planned spend downs. So I don't remember which page it was, but the tourism fund caught my eye. That was intentional going into this year. Reserves were a little higher, particularly because we'd been conservative during those COVID pandemic years. And as we learned during the pandemic, people just switched behaviors. So those revenues didn't tank as much as we thought they would. So fund balances built up a little bit there, and now we have a planned spend down for the next few years. So most of those, though, are a product of particularly the real-time sales tax collections. You're not seeing those fully banked for a 12-month period, and so revenues are occurring faster than those revenues are coming in, but in most cases are planned to balance by the end of the year.
Okay. Do we have anything else on financials? Is that all on that? Okay. All right. Okay, that brings us to new business. Do we have any new business?
Mr. Chairman?
Yeah.
It's not, this is not new business, but it is a thought and suggestion that I've been kicking around a little bit. I was going to run it by the Audit Finance Committee meeting and obviously talk to my other fellow colleagues. That is proposing to up the city manager's spending authority from the current 50,000 to 100,000. And the thought is there with the volatility and pricing and getting set pricing for different products and different things that we have to have in a city, to be able to give him that authority to do so, and also to help streamline agenda and different items such as that. So just throwing that out there that without any objections.
We had some, didn't we have some discussion at this committee last time about, that just in conceptually in that, about that, I thought, maybe.
I wasn't here last time.
Oh, well, I think we did. Anyway.
Oh, great.
And so we're on the same page. In fact, fact, I thought that was somewhere in the works, but I may be wrong about that.
I believe, and you all can correct me if I'm wrong, that the finance team has been looking at an updated procurement policy for council consideration, look to benchmark some of the other surrounding municipalities and their spending authorities. And I believe we're going to recommend that that be set at $100,000 to more accurately reflect what our peer cities are doing.
Kansas City does $1 million.
Yeah, buddy.
I don't know if we've got the, I don't know if we've got the pen strength for that, but.
Please don't give him that.
For sure.
Insubordination.
Well, thank you. That's all I have.
All right, good, thank you. So, yeah, all right, anything else, Mr. Walker, anything else for?
I haven't had a chance to discuss this corporately with the council, but in my individual visits with most members of the council, there does seem to be a desire as we move back into the budget presentation season to bring back in some form or fashion the departmental budget presentations. That used to be a past practice of this city and is a pretty common practice in most municipalities. There was a time where previous councils didn't seem to have as strong of an interest, and that was their prerogative, certainly. But this group seems to have an interest in maybe going through that in a little more detail. So we'll be having a conversation with the council to discuss what scheduling that might look like and get that done to help you with your review. So I just wanted the community to know and the council to hear that we are having those conversations and looking to bring that back for this fiscal year.
Okay, good. I'll look forward to that anyway. All right. All right, anyone have anything else for the cause? If not, then we will stand adjourned. We don't have to vote on adjourning, do we? I'm asking. No, okay, then we're adjourned.
Yep, there we go.
All right, thank you.
Good job, gang.
Yeah.
Megan, is it?
Yes, sir.
Megan, nice to meet you.
I was sitting there thinking, now, let me remember her name. I should be able to remember your name. I have a niece named Megan. I should be able to.
Well, perfect. Look at
Connect
us.
those dots real quick, you know? So, good.
Pleasure to meet you.
Well, welcome